About 3.5 years ago, we launched a partnership with the Bill and Melinda Gates Foundation called the Launch and Scale Speedometer that recognized that despite the tens of billions of dollars we're putting into the development of new technologies and solutions in global health, very few of them are actually reaching the people who need them most. So as we started to see the development of vaccines, as we started to see really other public health measures being put into place, what we recognized was that the tools we had developed in the speedometer could be applied so that we could generate some lessons learned in real time instead of looking back 10 or 20 years. In November of 2020, we released a report which we thought would be a single standalone report to highlight that there was a movement toward huge global inequities with access to vaccines.
But what we realized was that we were working in a very dynamic landscape where that data was needed. It was needed on a daily basis, actually, by policymakers, decision makers, funders, advocates. And it was changing constantly. And so we realized that the real value in the data and for the data to have impact, it needed to be regularly updated and it needed to be provided directly to the people who could use it.
In the speedometer, what we were doing was the primary research to understand what's happening with the vaccine marketplace, adding a layer of insights to it, and pushing that out to make sure that people understood the research. That still led to a gap on the policy perspectives as well as real accountability. So we developed quickly, jointly between our work here in the Global Health Institute, the Duke Margolis Center, and COVID Collaborative, this new effort, the COVID Global Accountability Platform, or COVID GAP, that's very much intended to fill this space to be an external, independent platform for accountability. We were able to pull together a letter to the UN General Assembly signed by over 100 leaders from around the world, calling specifically for real and aggressive targets for vaccine implementation in every country, not just in some countries. And that is the target that the World Health Organization agreed to, that the US government has also put forward.
We were able to use data to really describe what the challenges were, what the problems were, and what was needed. In some cases, we saw that helped push governments and decision makers, policymakers, and funders to change what they were doing and to do what was needed to take a more evidence-informed approach.
I think the most power value that COVID GAP provide is information for the citizen, information for the leaders, for the public and private leaders of the countries. It was very important for us to find information, and COVID GAP provide us a lot of information for the best practice to design and improve our strategies against the COVID-19.
What we're also hearing is that it's time to really think about how the COVID response also links to stronger preparedness and more resilient health systems around the world. So that's the next phase of what we're going to be doing with partners across low and middle income countries. I'm incredibly optimistic. I think what we've demonstrated, at least in a small way, is that the work we do in an academic institution is valuable, not just in a paper 6 months later, but in real time to decision makers and to policymakers around the world.